For those who are joining, we're still giving some time so that the rest of we get at least a good number before we start our webinar. But please note, for those who have already joined, this webinar is being recorded. And one of our tutors, Ms. Roslyn, is the one who is giving us a presentation, and we all aware of the topics, how the NCLEX is changing, and what this means for you and me, it is for all of us. So I'll just go ahead and introduce myself. So my name is Mary Sylvia Remwa. I work at Passcode as a business development officer, together with the panelists today, Roslyn and Zablon. We are very much excited to welcome you all in this webinar, hoping that as you join, you will leave with something. Let's keep conversation moving. Please, if you have any questions or any concerns, just chat on the chat box. You can also type your questions in so that we can answer them live. And in case any one of us would want to share their insights, or they would want to speak, just raise your hand and then we will promote you to panelist. As I had mentioned earlier, we are aware that Passcode Global Consultant is a firm that helps nurses to relocate to the US. Yeah, we have both registration and training sessions. So feel free, and you're very much welcome on this platform. Very much excited as well to learn more about the topics, the NCLEX 2026 test plan that is just about to, the next 2 months or so will be effective. So I believe our panelist is very, our presenter is very well versed. That is Ms. Roslyn, well versed with matters NCLEX. So let's give her a chance to explain to us and give us more insights. Also, I will give Roslyn 40 minutes. I think, is that okay with you, Roslyn? 40 minutes?
Yeah, that is more than enough.
All right. So 40 minutes so that you can explain to us, then we'll have a question and answers session. And then we will give a chance to 2 or 3 people to give us their feedback on how the webinar has been, and also to tell us what our next webinar topic will be. So Rose, please welcome. Yeah.
All right, thank you very much, Mary Sylvia. Good evening, everyone. I hope you can hear me. Let me get that feedback in the chat box. If you can hear me, if you're able to see my screen. I can see a feedback from Marion that we are all together. Thank you, Mary, as well. So I also believe that the rest of you can hear me, and welcome to this webinar. My name is Roslyn. I'm an NCLEX tutor here at Passcode Global Consultants. And today we saw it fit for us to share some updates, though minimal, about NCLEX, what is changing, what is not changing. But basically, you shall see that there are very few things that are going to change. But before I start, I'd like to hear from you. Perhaps, what have you heard about this upcoming NCLEX? What have you heard? It could be myths, it could be a truth. So let me hear from you. You can give your feedback via the chat box. I'll be able to read it out to the rest of the team. So what have you heard so far about 2026 NCLEX? So some people report that it will be purely based on clinical judgment, chances that it can be done remote. The emphasis will be on holistic care. The changes will start from 1st of April. Any addition? Some report about some changes in the exam style from April. All right. So all those concerns are valid, and so we shall see what exactly is going to change. And before we go to looking at what is changing and what is not changing, these are the objectives for this webinar. So we have the introduction and the overview. Of course, you'll have to understand what NCLEX is all about, why the changes, when do changes occur. And then we'll also look at what is next test plan, because our focus here is on the 2026 test plan. So we shall see what test plan contains and if there are any changes within the test plan. And then also see what is going to remain the same. A lot of things are going to remain the same. There's only a few changes, of which some of them are yet to come into effect. So I'll be telling you about that. And then we'll see what that means for you as a student. Will there be a change as far as your revision is concerned, or are you going to maintain the same revision technique? And then at the end of it all, I'll be welcoming you to give or share any questions, any concerns you'll be having, even as we complete the discussion. So I said from the beginning, it is important for us to understand the changes so that we can keep ourselves updated with these changes. So by introduction and overview, so the English is evolving. And understanding these changes is essential for everyone preparing to test in 2026 and beyond. Just like the way you see in different nursing procedures, sometimes we have updates. The way you manage a patient, perhaps with pneumonia, could be changing. And so we are saying the same thing applies with NCLEX, that it is evolving, it's not static. So with the updated NCLEX test plan, candidates, that is you nurses, will see shifts in content emphasis, clinical judgment expectations, and question design that directly impact how you should study and practice. So the body that usually is charged with setting NCLEX is called the NCSBN. NCSBN in full, that is National Council of State Board of Nursing. So usually it reviews NCLEX every 3 years. The last review was in 2023, and there we saw the NGN, the next generation NCLEX, being introduced. So which comprised of the case studies and the standalone. Before April 2023, they were not doing the case studies, but upon that review, they came up with the NGN. And so we want to see in this 2026 what's going to be different. So what is the NCLEX? Why is the NCLEX designed? So NCLEX is designed to test you as a nurse who's going to be an entry-level nurse in the US, to be a safe nurse. So it's going to test you more of the skills, though they can't have a practical session. So they test the skills theoretically. So they'll test you on clinical judgment and decision making. And that one started even in 2023 with the introduction of the NGN. The introduction of the NGN brought about clinical judgment. They don't just want you to memorize facts. They want you to apply. They want to test your ability to assess patients' needs, to interpret data, and make safe nursing decisions. Also, they're going to test you on prioritization and patient safety. And then a lot of this has been happening even before. So this is not new to us. For those of us who have been in the process, we've been revising. We keep emphasizing about prioritization, patient safety. So you need to know which patients need attention first, which tasks can be delegated, and how to prevent the harm. We're also going to test you on recognizing changes in patient's condition. So here, they are keen to see if able to identify early warning signs and signs of a patient who is deteriorating and prevent complications. And then also they're going to test if you know how to intervene, to report, and seek help. Okay, so you need to understand the limits of your role as a nurse and when to escalate care to the appropriate provider. So as I've said that right now, it's not about memorizing facts, but it's about more to do with application of knowledge into a realistic nursing situations, as well as effectively. Now, why should this worry? You know, whenever you hear about changes happening, of course, there is normally a degree of anxiety. But why do students worry about changes? Because you know that any change is equal to natural anxiety. So people become anxious whenever there are changes. Because maybe you've seen the previous groups were doing their NCLEX and the pass rate was good. And so you're wondering if this was going to change. Will there be still a good pass rate? Okay. So we have some common fears. Nurses will fear exams will be harder, right? Some people will fear that the exam will be harder. But you should not worry about this because the content will be the same. Some students will fear that study materials may be outdated. Okay, there may not be changes in the revision material unless they just have a review. Also, we have some fears like uncertainty about the new format. You don't know the types of questions or timing to expect, which can cause about stress. Again, we have the social media and rumors that can amplify stress. Some of us already have reported a few areas that we feel are going to change. And perhaps you may get this information by checking on social media or even hearsays. And some of this information can be misleading. And so it creates a lot of anxiety and even it creates confusion. So I'm just here to reassure you that these changes are usually an evolution, but it's not a completely new exam. They're not coming with a new brand exam. The core purpose, the testing for safety, they're testing you as an entry-level nursing practice. You should be able to provide safe care to the patient. That is the core purpose. It does not change as much as there'll be a few changes here and there, but that remains. So why do we have these changes? So I've said it's a routine thing that happens every other 3 years. So part of it is just updated or evolution that's done regularly. And that means that the exam also reflects the current demands of nursing practice rather than outdated standards. You don't want to be dealing with drugs which are outdated. I may give an example of ranitidine. You know, ranitidine was withdrawn from the market long time ago. So you don't want to be tackling an exam and you find ranitidine there. Of course, I'd be mentioning some other drugs that may be phased out because they're not in the use, especially in the US. So they want also the exam to reflect the current demands of nursing practice. Another reason why there's a change is just based on national nursing practice analysis. What do I mean by this national nursing practice analysis? So the nurses were practicing across the country, that is the US. So these people, they're able to come up, they identify the areas in terms of the knowledge, the skills, and the judgment that nurses actually use on the job. And then now that forms the basis under which they're going to have the NCLEX evolved. Because
Hi everyone, I hope you can hear me. Yeah, Rosaline is now back. we can give her a minute so that she sets her presentation.
Sorry for that. Just allow me to reshare my screen. I had a hitch on the connectivity, but I hope you can hear me now. Just allow me to reshare my screen and then we move on. All right, kindly confirm that you can hear me.
Yes, we can hear you now.
Right. Thank you. My apologies once again for that technical hitch. And so I was trying to explain what the changes, why the changes, and especially the bullet point based on national nursing practice analysis. So I said survey will be done across the country and across the different states in the US. And they usually base it on the knowledge, the skills, and clinical judgments that nurses actually using on their job. Okay, so they try to align the test plan based on the real world nursing. So it's not more like a textbook where you just read and you answer questions, but I want you, even as you go to transit and practice in the US, able to apply the knowledge. For example, on delegation, who will be working hand in hand with in terms of prioritization. So they want to make the actual practice in the US, and that's why they want to update you on what is happening there, so that you can also focus on your revision. So the key point here is just to mean that the updates are designed to make NCLEX a reliable test for a safe entry-level nursing practice. So they're not here to make exams harder. Some time back, I was able to attend one of the conference, and you find that that team is very supportive. That team is not there to make the exam difficult. The team, the NCSBN team, they had a conference online and I had the opportunity to join. So they usually look at how NCLEX was there before, what is the current passing rate, how are the new students enrolling, which country has the most number of students enrolling internationally. And so they also give international pass rate and the pass rate based on in the US. So the team was there saying that in the previously before the new gen, that was 3 years ago, you find that nurses were not doing well, students. But upon introducing case studies, clinical judgment model of NCLEX, the pass rate improved. And that's why you've seen even in the recent past, most of the nurses are doing well, especially in the case studies. So that is something that's going to be upheld as far as NCLEX testing is concerned. So also, why does the NCLEX change? Another reason is just to reflect key healthcare priorities. That is all about patient safety priorities. For example, NCLEX will emphasize on tasks and decisions that keep the patient safe. So when you're doing your NCLEX, you'll always find questions on safety. Every other time, safety. And that is usually the priority thing to do on a patient to protect the patient from harm. For example, recognizing early signs of deterioration, preventing errors, and knowing when to escalate care. Still under this, reflecting key healthcare priorities. Another point is about healthcare complexity. There's modern technology. Currently, we're talking about AI. So modern technology is more complex than ever. technology, chronic illnesses, and care coordination. It keeps changing. So also the exam now includes scenarios that mirror these complexities. Thirdly, is about clinical judgment demands. So nurses must make quick, evidence-based decisions. We're talking about rapid decisions. So you find a lot of them under case studies. Are you able to recognize complications? So NCLEX increasingly test how you think and decide, not just what you memorize. So they're running away from you cramming. They're running away from you cramming answers. They want you to think critically. So let's look at the test plan. So I've said we're looking at 2026 test plan. So what is a test plan basically? So the test plan is a blueprint of NCLEX. It's like a map that shows what the exam covers and how it is organized. It tells you what content will be tested. You shall look at the adjustments. You shall look at how previously, in terms of the questions, what they used to focus more on, and if there is an improvement in the number of questions you expect to get. So the content remains the same. Those are the topics and the concepts that you need to know. The test plan also tells you how often the topics appear. I'm sure for some of us who've been undertaking our session, we keep emphasizing on certain areas, certain medications that are commonly tested. So again, as you take you through this test plan, those are the areas that you need to focus on, because the question that we'll be getting on your NCLEX will majorly be on certain areas. I'll be showing you that distribution later. Also, it tells you how questions are structured. That is the type of questions and clinical scenarios. So there are 4 major categories. And I know even for your case, the modules that you normally follow for our students here at Passcode, they're usually based on the main modules. These are still there. Nothing has changed with them. Safe and effective care environment. We have health promotion and maintenance. We have psychosocial integrity. We have physiological integrity. These are the 4 major categories. And then under these major categories, now we have the subtopics under them. So allow me just to share some of the topics that you normally cover during the content coverage. So under safe and effective care, we normally talk about management of care as well as safety and infection control. So you'll find that they've introduced what is called safety and infection prevention control. Initially, it was just infection control, but now they've introduced the aspect of prevention, the IPC. So under management of care, we have topics like ethical legal nursing. This has everything to do with the ethical legal issues like assault, the advanced directives. All those are under legal ethical consent signing. And then you also have the nursing leadership and management, client rights, confidentiality, information technology. All those topics are covered under management of care, which is still under safe and effective care environment. To talk about SECE. Still under safe and effective care environment, you also have safe and infection prevention and control. So under this, the topics that you encounter will include injury prevention, disaster management and planning, protecting client safety, preventing and controlling infection, prevention of errors and accidents, implementation of standard precautions are there, aseptic technique, the use of restraints, disaster planning, handling hazardous materials, emergency response plan. All those will be covered under safety and infection prevention control. So I'll be telling you how many questions or what percentage of questions you're supposed to get under the safe and effective care environment. The other major category is called the health promotion and maintenance. Health promotion and maintenance. So this has everything to do with midwifery, reproduction, family planning, and those two are not as many as common as in the case of safe and effective care. It has topics like infertility, antepartum, intrapartum, and postpartum care. We have newborn care, growth and development as a topic, immunization as a topic, child health, aging process, and age-related care. We also have health promotion and disease prevention, principles of learning and teaching, high-risk behaviors, and healthy lifestyle choices. So you've heard of nurses who have gone into the exam and they didn't get any question on health promotion and maintenance. Okay? It's possible that you don't get a midwifery question, but it is impossible if you don't get a question on safe and effective care environment. Most of the questions will test how safe are you as a nurse. So you can never miss a question on this package. If you miss a question on this, no problem, because most of the international nurses don't go practicing in the midwifery. You rarely get nurses being recruited in as midwife in the US because you'll find that doctors are the ones who conduct a delivery. But again, it's good to have that knowledge with you. And then thirdly, we have psychosocial integrity. This has everything to do with psychiatry. So any topic on psychiatry, schizophrenia, bipolar, substance of abuse, all those fall under psychosocial integrity. We also have the topic on end of life care, grief and loss, sensory and perceptual alterations, cultural, religious, and spiritual influences, behavioral interventions, crisis intervention. We have chemical and substance use dependency, abuse and neglect, therapeutic communication. So again, this is not a high yield area, but if you get a topic on it, then again, it's important for you to get it correct. And then you have the last main core, which is the physiological integrity. So normally say this is the mother of NCLEX. This is the mother of NCLEX. So it has 4 parts: basic care and comfort, pharmacological and parenteral therapies. We'll also look at reduction of risk potential and physiological adaptation. So the entire of your NCLEX is likely to be focused on physiological integrity as well as safety. So under this, we have basic care and comfort. So here you go through topics like the use of assistive devices, mobility, nutrition, oral hydration, personal hygiene, elimination, as well as non-pharmacological comfort measures, rest and pain. And then you have the pharmacological and parenteral therapies. This carries a chunk of many, many questions on NCLEX. Pharmacology. Some of us, we fear about this topic of pharmacology. So pharmacology questions are a lot because of the nurse. You'll be giving medications to patients. You need to understand what are the adverse effects, what are the expected effects. So that is taught under physiological integrity, but subunit of pharmacology. So for those of us who have opportunity to join Passcode, we have been talking about this, be discussing about the different drugs for various systems. And then also you have reduction of risk potential. This includes the pathophysiology, the different diagnostic tests, the precautions you undertake for those particular diagnostic tests. We have lab values being there, vital signs being there, and performing assessments on a patient. So you're only supposed to identify the complications that can arise following the diagnostic test. And then lastly, we have the physiological adaptation. Now, this last point or the last subunit is now where you're tested about all the systems, the conditions in the cardiovascular system, respiratory system conditions, be it musculoskeletal system, interjumentary, all the systems are covered under physiological adaptation. Besides that, you'll also be taken through hemodynamics, medical emergencies, convulsions, and just basically management of illnesses. Okay? So it's important for me to highlight this because I know we need to know which areas, even as you do your revision, do I need to focus more attention on. And then besides that, now I want us to see what is changing. So having seen the different test plan areas, let's see what is changing as far as the test plan areas is concerned. So I said there's no much that is changing. Very few things are going to change. And actually, most of the changes come into effect at the beginning of April, 1st of April. So what is changing? There'll be refined emphasis on clinical judgment. There'll be refined emphasis on clinical judgment. So that's just to build on the NGN. The NGN introduced this clinical judgment. So you'll be dealing with the patient where you focus on recognizing cues, where you focus on analyzing data, on prioritizing actions, evaluating outcomes. There'll also be an updated language in test plan. I've mentioned an example is the test plan under safety and control and infection control. It will be changed now to be called safety and infection prevention and control. So they want to be more of proactive. They don't want to deal with issues. They want to prevent them from occurring. So the emphasis will be on preventing issues before they occur, not just having a knee-jerk reaction. Thirdly, healthy equity and patient-centered care. So going to introduce cultural considerations, respecting beliefs, values, and traditions. They have to focus on that because in the US, there are a lot of immigrants. The Asians don't do the same things as the Black Americans. The whites also have a different way of beliefs as compared to the Spanish. So they're going to also put into consideration the cultural considerations, including the gayism and the lesbianism. It will be there. So you find that they don't use he or she. You don't use he or she with NCLEX questions. Usually, it's neutral. So bias awareness care, recognizing and reducing personal and systemic biases. In addition, social determinants of health, that is understanding factors like income, education, and environment that can affect patients' outcome. We also have ethical decision making, that is balancing patients' rights, safety, and professional standards. All these things are just geared to the ones who are going to set the exam. For you is to focus on the revision using the relevant textbooks available. Also, activity statements may be updated. That is to reflect modern nursing practice. Prioritization, delegation, as well as technology and safety. So like having to double check dosages to prevent errors, as well as the use of technology. They're going to reduce those things. What is changing? There'll be integration of multiple concepts. So questions will be combined, that is physiological, psychosocial, and safety elements. Students must think about a whole patient care, not isolated facts. I saw someone mention about holistic care. That is exactly what's going to happen. They'll not be isolating a patient like you are just tackling their physiological care. They'll go to the extent of even testing you on how to provide psychological, taking care of the emotion, especially after losing a loved one or even anxiety before an operation. So basically, you're saying we want to shift from what to why and how. The old style used to focus on recall. For example, which medication is used for managing hypertension? We want to move out from that. We want to focus on clinical and reasoning. For example, a patient shows these symptoms. What is the priority action as a nurse? So we emphasize more on understanding why you're doing something instead of just memorizing. Now, in terms of the question distribution in the various test plans that I've mentioned about, so this is how the questions are distributed. And we know that NCLEX, the minimum number of questions you're likely to get, we have 85 to a maximum of 150. So it gets a minimum of 85 to a maximum of 150. So these percentages, it comprises of 17% of the minimum questions, 7% of the minimum, 7% of the minimum, 8% of the minimum, depending on where your computer shuts. Okay? So let's see. For safe and effective care, initially it was about 17 to 23%. And you can see it's like it's the second one. If you look at across the other domains. So this one comes in number 2. So the same has been retained in the 2026 test plan. And then for health promotion and maintenance, it was 7 to 13%. It's similarly the same, only that's a drop by 1% over here. So this one has a tie together with psychosocial. They come in at number 3. Psychosocial says about maternity, about psychiatry, with around 7 to 13%. So again, it's equally the same. There's no rise, just a slight drop here. And then the last one is on physiological integrity. And I said this is the mother of NCLEX. This is the one that carries the highest number of questions that you're going to get on your exam. It was around 57 to 63%. Currently, it's gone up slightly to around 58 to 62. So it means that a student, as you're revising, these are the areas to focus more on. I'm not saying you should not focus on these two, but the majority of the questions will be coming from psychological integrity and safety. So these are further distribution in terms of the details. So you can see management of care takes about 18% of the questions. Pharmacology comes in second, around 16% of the questions that are going to get. The one that comes in after that is the physiological adaptation with around 14%. And then safety come in with 13% of the questions you're going to get. After that, you have reduction of risk potential. And then you have the last ones, which are share. That is health promotion, psychosocial integrity, and basic care and comfort. So as a student, as you're revising, it means you need to put more focus on pharmacology, for example. You need to focus on management of care because those are the areas that you're likely to get most of the questions from. Another thing, it's always important to ask the students who have done NCLEX. Find out the area that they got their questions from. They'll be telling you, my question came from 1, 2, 3, 4 areas. And so if you're sitting exam within the same duration, they usually issue a batch. Okay? So questions tend to be repeated. It may not be the same, but you'll find if you're testing you a case study on diabetes, you'll hear, I got a question on diabetes. Someone else will say, I got a question on diabetes, probably in February. Come March, you'll find students saying, I got a question on GOMCO, circumcision. And you'll hear several students saying, I got a question on the same. So it's important to always find out what has been tested before and use that to focus your revision on. What about changes in medications? So we also have some drug updates. So certain medications may be removed from NCLEX test plan if they are outdated and rarely used or replaced in practice. So the focus shifts to medications relevant to current nursing practice, including commonly used medications across all healthcare settings, high-risk medications where safe administration and monitoring are critical. Why does it matter? You don't need to memorize outdated drugs. Examples of these drugs that are outdated, like Resapine. Resapine was an old antihypertensive, which was now replaced with the beta blockers. Okay? Methyl-dopa, it was an old antihypertensive. Though it's used for pregnant women, but is rarely used for general population. Another that I've heard that maybe eliminated, you have the statins. Not all the statins, but a few of the statins. You may find them also removed from the key drugs that you need to focus. So the drug updates, examples of drugs that are traditionally tested less now. So these are guaranteed, they aren't guaranteed to never show up, but they are less emphasized because they're outdated, are rarely used, and low priority in current practice. For example, you have the ranitidine. It was common for ulcers, but currently there's changes because it was thought to be associated with some cancers. And then also you have some older or rare analgesics for pain like pentazocine, butoprolol. Okay, also those ones may not be able to find them on the new NCLEX. Also, they're going to remove some brand names that are not used in generics. For example, Tylenol. So instead of that, we use acetaminophen. Okay? And then you have those drugs that are going to remain. And again, we call them high priority drugs. The anticoagulants, you have to master those ones. Heparin, warfarin. You have to master about insulin and diabetic drugs like metformin. Metformin is loved by NCLEX. Insulin is loved by NCLEX. Those are areas that you need to master. They're still going to be there. CVS drugs like digoxin, metoprolol, Ateno, the beta blocker, that is, the S inhibitors, the furosemide. Again, those are key drugs when it comes to cardiovascular system that will still remain. We have some respiratory medications like albuterol, prednisolone, generally corticosteroid. Again, that is a focus that you need to know. The opioids and pain management, the morphine, the hydromorphone, the fentanyl. Also, you have to master because they're still going to be tested highly on NCLEX. And I'm just giving you a few examples. The rest we'll discuss more on our classes. The last category that is highly priority drug are the psychiatry drug, if you get a question on psychiatry. So we have the selective serotonin reuptake inhibitors. The SSRI is a good example is sertraline. The antipsychotics. Again, these are drugs that you must know. Now, I heard some of you mention about remote. So let's talk about this future NCLEX, that is remote or at-home testing. So you know that currently, you must do your exam at a Pearson View Center. Okay, currently there's no official at-home option existing at the moment. But what is planned is that NCLEX is developing an online or remote NCLEX option, which uses secure remote proctoring That is webcams, the microphones, the AI monitoring, and room scan. So the goal here is to make the exam more accessible without compromising exam security and integrity. So this is thought to begin this year. If at all, they'll have to start perhaps in April. Usually things begin in April. So as a student, you need to be ready for that. They may start with those advanced areas. They're yet to say the countries. I don't know if it's going to be all at once. We shall get that communication. But of course, they don't want to start something and then maybe you're coming from an area with poor internet connectivity or even power losses. No, that will affect also your results. So they have to survey all these countries and see which ones can have this enrolled. But as for now, the plans are underway. So what are some of the requirements for remote testing? This is based on the proposed standards. First and foremost is technology. So you must have a reliable computer or a laptop, a webcam, microphone, and high-speed internet. Testing environment should be private, should be a quiet room with clear desk with no interruptions. Safety checks include ID verification. There'll be a 360 room scan. That means you cannot have material somewhere that you're going to be reading and as you answer your question that you're referring to. So you'll be guided on how to install all this in your computer before they can now roll out this remote testing, because they have to ensure that the exam still remains to be secure and upholds integrity. People should not be copying the exams. So that 360 degrees is going to see how your room is, including any material around you. So if you're found cheating on your exam, then automatically you're disqualified. So don't think that if you're doing it from home, then I'm able to have materials around to confirm answers. No, those things will be put in place. And then you have pre-exam test check. That's to ensure system compatibility and connectivity. So in terms of timelines, so I've said the official time is yet to be communicated, but the period at which this is supposed to start is April this year. But if there are any communication about it, it will be made in time. Just like the way we started the NGN case studies. From January, we used to hear of hearsays, but now upon getting to April, that's when you got to learn about the exact times going to start. So I think when all these are put in place, then the tentative date for beginning the remote or at-home testing is supposed to be at the beginning of April this year, 1st of April. But of course, more updates will be shared in due time. So advance notice will be provided by NCLEX-PN when online NCLEX is available, and testing will likely remain optional. Candidates can still choose to go in person to the test centers. So if you want to travel, you can still travel to the country of your choice that can be able to offer the testing center. I know most of us used to enjoy taking those flights to different countries. So if you still want to go through that process, you still have that option. They're not getting rid of it. What about the passing standards? So the NCLEX-PN has not officially announced the finalized passing standards as of January 2026. So the panel met in 2025 to review the standards, but the board final approval and public release are expected before April 1st of 2026. So be aware that after 1st of April 2026, the passing rate may officially change. So take note of the word may officially change, but the framework and the content area remains the same. So don't worry about hard questions. or guessing specifics about the standard, you focus on mastering the content or the material. What is not changing? It's going to still to be a computer adaptive test. So a minimum of 85 to a maximum of 150. And the duration that's allowed is usually 5 hour period. What's not changing? The core nursing content is not changing. I've said you have 4 main domains, they still be there. What is not changing? NGN items are not changing. So you have the case studies, the standalone items. At the same time, the classical questions will still be there. Okay? What's still the same? Passing NCLEX is still there because they're going to test you on how safe are you as an entry-level nurse. Okay? So those things are not going to change. The focus remains the same about you providing safe care. So what does this mean for students and how to prepare? So how you should study? You should focus on why an answer is correct. Focus on priority. Focus on safety and outcomes. Practice the NGN style case questions, the case studies. Understand the rationale deeply. Strengthen your fundamentals of nursing. Strengthen your pharmacology. Strengthen your safety. Because you say those are the areas that carry the greatest percentage of the question that you're going to get. Okay? What not to do? Avoid memorizing facts. Avoid panic over these 2026 changes. And focus on mastery of content. So yours is just to wait. We see the update that will be coming from the NCLEX-PN concerning those areas that I've mentioned are going to change. And so that was my brief PowerPoint presentation on what we are expected to have as far as NCLEX is concerned. So thank you very much for listening. I'm going to take it back to Mary so that she can guide us on the next steps. Thank you for listening.
Thank you so very much, Rose, for that. Was so insightful and a very good and powerful presentation. I believe we have all learned 1 or 2, 3 things. So please keep your questions coming. We are also ready to and happy to answer them. So if I can just briefly tell you who Passcode is. We are an education and migration consultancy supporting students and professionals to access global opportunities. Majorly, we support students to go to Germany, Australia, and the USA through ethical guided pathways. So we have over 5 years of experience and over 300 success stories. That is for both nurses and students. What we do majorly at Passcode, our main services include, not limited to, career assessment and pathway guidance. We also help you with university and employer applications. We also do document preparation and recognition, language training, that is German language. We also have English, that is IELTS, TOEFL, OET. And then we also train on NCLEX. Last but not least, we also do visa guidance, and we also do post-arrival support, most especially to those who are going to Germany for studies and others to go and work. So in all this, it's very important for you to note that Passcode Global Consultant will take you through all these steps very well and guided very well. So we handle this process with you so that you don't apply blindly. And in most cases, for instance, when you're applying for the USRN job, you find that sometimes it becomes difficult or it becomes a challenge for nurses to choose their correct board of nursing state. So Passcode, we will guide you and we will help you through that. Just as I've said, we have supported many nurses, over 300, just to choose the right board of nursing, which has also enabled them to endorse their licenses once they get to the US. So for those who are looking to relocating or maybe going to abroad, you can book a consultation with us. We have our WhatsApp groups and Telegram groups that have shared on the chat box. Kindly join. Another way on how you can reach out to us, we have our enrollment forms that are going out there. Kindly fill the forms so that we can enroll you and we can have a personal guidance with you as we work together. So even as Rosalind has shared, the test plan that is coming up, I believe we have all understood and we all have our questions. So Rosalind, please take over. I will just read a few questions for you so that you can answer them. Someone
Right.
is asking, someone is asking, can someone purchase the same question banks like bootcamp UWorld if in case she's sitting for the exam in June or July? That is one. Another one is, what was the passing standards before 2023 to 2026 changes? Then someone is acknowledging, thank you very much for a wonderful presentation. So you can handle those two, then I'll handle the rest as they keep coming. So to the attendees, please keep your questions coming as we answer. I think we have like 20 minutes and then we will call it a day. Thank
All right,
you.
thank you very much. Thank you very much, Mary, for that. So about the purchase of QBank, the options are unlimited. We have Bootcamp, we have UWorld, you have NCLEX. There are many. So you're free to choose any QBank because it's simply for practice. Remember, questions do not appear the same. When using the QBanks, focus on the rationales. Focus on reading the rationales. Even if you get the question correct or incorrect, read on the rationale. So we have some good QBanks. I'm not here to market any of those, but Archer is good, Bootcamp is good, UWorld is good, and many more. So again, it depends with the cost and your pocket. They come at different packages. So go look up if you're interested in 1 month package. There's those ones that have 3 months package. You have the 6 months, even one that has 1 year. Again, you also have some free offers like the NCLEX. If you can just do Google NCLEX and then you use a free 2-week revision. After the 2 weeks, you can use another email to have an access, or you can now decide to purchase. So if you're sitting your exam in June, July, you can go ahead and purchase as long as you've done the content. The most important thing is that the content is what matters, okay? The content is what matters. Do the content and then do questions. Other question was about the previous passing standards before 2020, before the 2026 changes. So there's not a specific pass rates. We normally talk about confidence level. Remember, it's a computer adaptive test. Usually it analyzes how confident are you after a certain number of questions you have tackled, and then the system shuts. So the developers of NCLEX, the NCLEX-PN, they have 3 standards that they use, but the most common one is the 95% confidence interval or confidence percent. And then you also have that's called running out of time model. And then also you have those ones that will complete the entire 150 questions. But there's no a pass mark like saying when you get 75% you've passed. No. Usually there is a line that is drawn. So this is the baseline. So if you tackle questions which are considered to be moderate to hard questions, your graph tends to be above this baseline. So you'll be getting your graph playing around this area. If you're just tackling easy questions and you get this correct, your graph will be based on this area below the baseline. So at the end of it all, your computer will shut. So it shuts and your graph is on the baseline, below the baseline, you fail. Even if you're getting these questions correct, you still fail. So always focus on getting medium and hard questions, even as you do your practice. Because at the end of it all, when the computer is shutting and shuts above the baseline, you pass. So it is a computer adaptive test. It analyzes how you perform on the previous question. So usually it starts. It gives you a medium question. You get it correct, it gives you a more difficult question. You get it correct, it gives you another hard question. If you fail, it gives you a medium question. If you fail, it gives you an easy question. So that's how it goes until it's able to establish the confidence level. Okay? So that is how the system, the pass rates are conducted. So we don't have a specific like percentage. So I hope I've answered that one. So the rest, I think I'll be passing over to you, Mary.
Thank you so much, Rose. There's someone who is asking, do you guys do Ausbildung? My answer would be yes. And please, if you want to get more information on the German pathways, we are having another webinar coming Sunday, that is on 8th. Same time, 7 p.m. to 9 p.m. Please purpose to join so that you can get more information on Ausbildung. Then there's someone who is also asking, are the module going to change? I think this one I'll pass it over to Rose. Yeah, and as now Rose handles that question, please purpose to join our social platforms. I've shared on the chat box our social platform, that is the YouTube channel, our LinkedIn profile, and also our TikTok and our Facebook. Get more information on us, and also you can also visit our website, www.Passcode Global Consultants. You will get more information. And for those who are asking, please don't miss on the German webinar that we're having on the 8th. Register. When you follow us on our platforms, you'll be able to get the link on how to register for the Zoom. Someone is also asking, do you have classes? Is Roslyn the tutor? I have loved her teaching model. Someone is acknowledging and likes how, Roslyn, you handle your students. So congratulations and well done on that. So Roslyn will also atabrag kidogo kuhusu hiyo. Yeah, and there's someone who is asking, free once nurse, what I did, there's something you talked about and then they didn't get it very clear. Also help to answer that. So as Roslyn now answers those two questions, for those who questions will not be answered here, please follow us for a more guidance, one-on-one and personalized conversation. Yeah, so Roslyn, please take over, and then after that we will give a chance to 2 or 3 people to just give us feedback on how the webinar has been and what can we do what can we improve on, and also maybe suggest what topics they would want us to discuss on our next webinar that is coming on 15th. Yeah.
All right, thank you, Mary, again. So allow me to answer the one who was asking about the name. So this is the name, it's called NCLEX. You can Google and then you create an account. It's usually free for 2 weeks. You can do as many questions, especially on the readiness assessment. Okay. So I've said I'm not marketing any particular QBank. The many which are available is up to you to see which fits you. But I know with Passcode, usually they love you or they advise you to use more of Archer, which is also very good, equally very good. Now, are we able to identify difficulty or medium questions? Now, when you're using the QBanks, if you've been practicing using good QBanks, usually they grade the questions. They grade the questions as either easy, they grade them as medium or even difficult. So before you do exams, you normally advise to have a Q bank. So if you're using a Q bank and you find that I'm only getting easy questions, if I'm given a medium or a hard question, I'm failing. It means there's a problem somewhere. Because the same standard that I use to develop difficult, medium, or easy question, these are standard techniques. They are cut across most of the Q banks, including the real NCLEX. So find out during your practice, am I getting easy questions only? Am I getting medium questions? Am I able to get hard questions? I know a Q bank like Archer has a provision of tackling an entry cut or an entry test. That test usually uses only difficult questions. So check and see how you perform in that cut, for example. If you're able to get pass in that cut, because they usually utilize difficult questions, if you're able to get a pass in that cut, that means your skills are sharpened very well. Mercy, thank you very much for that compliment. Yes, I'm the one who also take you through the evening classes. So thank you very much for that recognition. I hope I've answered you, Shiamielo, about the name. I've written it there, NCLEX. You can just Google NCLEX, and then you create a 2-week free account. Once it expires, you'll be required to purchase. Mercy is asking about, so it won't affect any changes that will be happening. So I've said very little changes are going to occur. What you've been doing, continue doing them. Only that they have added the aspect of remote testing. Judge Njoroge is asking about their modules. They're going to change. The domain, the key modules are there. I think I shared that during the presentation. I said the modules will still be there. Only that the distribution of questions will slightly vary. So as you're answering, focus more on safety, focus more on physiological adaptation, because those are and pharmacology, those are the areas that are going to be tested widely when it comes to NCLEX. Purity Kinyude is asking, can you talk more info your UWorld Q Bank? So as I've said from the beginning, I'm not here to market or demarket a particular Q bank, but I've said there are various types of Q banks available in the market. Okay, with good standards. Some come at different packages with different durations. You can always do a comparison and see what fits your needs. The people who want detailed rationale, for example, if you look at UWorld, usually has a detailed rationale. Explanations are detailed. You can actually cover a whole area when you go just through one question on UWorld. But if you're someone who wants brief and precise points, Archer will provide that. So I'm trying to say that each Q bank has their niche. They will sell to you what they feel is important for you. And that's why we have variations of prices. So I can't speak for a particular and speak against a particular, because all these are good sources when it comes to practice of NCLEX questions. I think I've answered most of the questions, so I'll take this back to Mary, maybe if there's any that I've not highlighted, and even to end the session there. Thank you for listening.
Okay, thank you very much, Rose. We really appreciate you being here today and also taking your time to just get let us know on what is coming up as the 2026 NCLEX test plan is concerned. Thank you so much. Just want to give a chance to 2 or 3 people just to share feedback. Please, if you can talk, if you are ready to talk, please just raise your hand so that we can promote you, and then you give us your feedback. And also note that this webinar has been recorded, so it shall be uploaded on our YouTube channels purpose to follow us and get to know more, and also get to listen to it more and more. Yeah. I don't know, Zablon, from your end, if there's someone who would wish to say something, please promote them. So if not, I want to call it a day. It has been a great session. Thank you so much for those who have joined. Thank you so much for those who have been who joined. Someone was asking for Rosalind's contact. Please, we will answer you privately. Kindly follow us so that we can share all this. And I'll just leave you with one thing, that at Passcode Global, we are here to work with you, and we are here to make your dreams come true and secure your future success. So for those who have not yet enrolled in our classes, in our review program, this is your chance. We're having our next intake that's beginning on 9th of February. Purpose to start, and also contact us to get more information on how you can get enrolled. Thank you so much for taking your time to join. See you next time, and may God bless you. We can leave at our own leisure then.